This segment is sponsored by KidMed Pediatric Urgent Care. We're joined today by the team from KidMed Pediatric Urgent Care, Dr. Mark Flanzenbaum and Jeff Bennett. Dr. Jeff Bennett, it's great to see both of you today. Thanks for making time.
Thank you. Thank you, Jessica.
An important conversation. We're going to cover a couple topics here that are top of mind for parents. Number one is this rapid COVID testing. And Dr. Flanzenbaum, this is something that is pretty important right now. It's becoming more in demand, and thankfully there's news that it's more readily available.
That's correct, Jessica. We've had the rapid testing for a couple of weeks now, and it was pretty limited supply, but we've now been able to procure a larger supply. So we should be able to test anybody who needs or wants to be tested. The nice thing about it is a rapid test. We do a result within about 15 minutes, as opposed to when we would have to send out to a lab and it would take anywhere from 7 to 14 days to come back, which really made it sort of pointless to get the testing done. So now it's a very quick test. And we should have the availability to get most everybody tested who needs to be.
Doctors, there are plenty of reasons parents may be looking for a rapid COVID test, but when is it time to get this done?
Well, the two times are, one, if you have symptoms, you've had it long enough that it's worth testing at that point. So the symptoms are cough, shortness of breath, the upper respiratory symptoms, or the GI symptoms, which are nausea, vomiting, diarrhea, or loss of taste, loss of smell. So anybody with symptoms or anybody who's been exposed to somebody with COVID, you really should wait about minimum of 4, preferably 5 days after, because before that, the test is not accurate enough to pick up the amount of virus that you have in your system.
And if you do a telemedicine visit and it's determined that you should be tested, you can stay in the car. Someone will come out and get the swab in the car. It's just a nasal swab, very simple, not painful. And then we'll call you with the result once we get it back in about 15 minutes.
That really is incredible, because going from supplies being limited to now having the option of having this done, and the difference of 2 to 10 days versus 15 minutes is huge, because when you need to have this test done, you need results.
That's correct. It has a lot to do with who has to be quarantined, who can resume activity, go back to work. So it does make a huge, huge difference having that quick turnaround.
KidMed Pediatric Urgent Care specializes in young people, in children, and children up to a certain age. Dr. Bennett, let's talk through that, and let's talk about the other thing that's critically important to parents right now, and that's telemedicine.
Yeah, telemedicine has really taken off during the COVID pandemic. We are seeing kids up to age 25. We increased our age just because of the need for kids, especially the ones that were home from college and professional schools and whatever. So we're seeing up to age 25. We're doing it through telemedicine. COVID exposures are a great thing that we can use telemedicine for, because what you can do is you can call in, I can evaluate you and just see that you're not short of breath, go through all the symptoms, and then you can come to one of our 4 facilities and get tested for COVID. We can also do strep testing if the patient also has a sore throat. Urine is another thing that we can do. Some of the things that we really can't do on telemedicine is orthopedics, because we need to do our x-rays. So we ask those people to come in for an x-ray. Kids under the age of 2 with fevers are really difficult to evaluate on telemedicine, and certain other things. So usually we'll have the telemedicine visit for most things, but some things we'll ask the patients to come in for. So it's worked out really well. On the other side, though, people don't have to be afraid to come in if they really have something that they feel like needs to be seen, or we need to evaluate it in person. We're separating all the parents. They're able to register from outside, and then they're able to come in. It's an empty waiting room. They go right to a room and are not really exposed to anybody.
That's critically important, because while you have the option of the telemedicine, there may be an in-office visit that is necessary. So you want to make sure that happens. We're almost out of time, but doctors, I want to ask you about the difference between coming to a pediatric urgent care versus an urgent care space for adults. Why is it so important for parents to consider that?
Well, the easy answer for that is that, kids are just not little adults. That's the biggest myth out there, that the majority of illnesses that we see in kids present differently than they do in adults. And if you're not comfortable or knowledgeable about how kids present, there's the risk of missing things. So it's extremely important for kids to be seen only by either the pediatrician, a pediatric emergency department, or pediatric urgent care. There really should be no other option just because of how different kids present.
Yeah, if you didn't train in that particular field, you're just not privy to all the parts of that field. So there's certain things that I can't do cardiovascular surgery. But realize that when you do pediatric residency, that's what you're good at.
Well, you guys are both wonderful at what you do. Thank you for this update, and thanks for making time for us. We appreciate it.
Thanks so much.
Jessica. Thanks.
Yep, great talking with you. KidMed Pediatric Urgent Care, available for everything that you need. We're sharing the information so that you can connect.
KidMed Pediatric Urgent Care is located at 8356 Bell Creek Road, right there in Mechanicsville. For more information, you can visit them online at kidmedva.com. And we hope you'll stay tuned, because we'll be right back after another quick